Sometimes the best ideas take shape in the most unlikely places, using the most unconventional devices. In the case of the Area Health Education Center for South Texas, AHEC for short, the creative forces behind the venture met at a Brownsville donut shop and laid out their plans on a paper napkin back in 1988. 20 years later, after that fateful meeting between Paula Gomez and Dr. Peter Plantes, the plans sketched out on that napkin have yielded a 100-fold harvest. AHEC has grown into a major player in meeting the healthcare needs of the entire South Texas community. It's no secret that South Texas has historically ranked as one of the state's medically underserved regions. That was the situation Gomez and Plants faced back in the late 1980s. They recognized the immense need for health care and health education in the region, and they sought a creative way to meet that goal. 2 more figures were brought into the planning stage: the University of Texas Health Science Center at San Antonio and Dr. Ciro V. Sumaya, who would later become AHEC's first director and the principal investigator for the federal grant submitted to create this new venture. Under Sumaya's guidance, AHEC met with the region's local leaders, targeting the greatest area of need. In its first year, AHEC provided training programs for students studying medicine, dentistry, nursing, allied health, and pharmacy.
I think that it has helped me because it's really beneficial. It's helping students from South Texas, like me, to succeed in our future careers as healthcare practitioners.
AHEC grew, branching from its original epicenter in Weslaco. 5 freestanding centers located throughout Texas serve different parts of the region. Lower Rio Grande Valley AHEC, covering Cameron, Hidalgo, Starr, and Willacy counties, and serving over 1.2 million residents. Mid-Rio Grande Border AHEC, covering Webb, Zapata, Jim Hogg, Duval, LaSalle, and Dimmitt counties, and providing resources and services to over 70,000 students and healthcare professionals throughout AHEC's 20-year history. Southwest Border AHEC, covering Maverick, Kinney, Valverde, Edwards, Real, Uvalde, and Zavala counties, and serving the Kickapoo Traditional Tribe of Texas. South Coastal AHEC, covering Bee, Brooks, Jim Wells, Live Oak, Kennedy, Kleberg, McMullen, Nueces, and San Patricio counties, and serving 300,000 residents. And South Central AHEC, covering San Antonio, Bexar County, Atascosa, Bandera, Como, Frio, Gillespie, Guadalupe, Kendall, Kerr, and Medina counties. Throughout its 20-year history, AHEC has served countless students and healthcare providers throughout the South Texas region. Through these efforts, AHEC has helped to vastly improve the region's healthcare landscape to the various communities the center serves.
The greatest impact it had on me was that it gave me more confidence in myself and helping me realize that I can do this.
I would recommend AHEC. I think it's really important to be part of a community group like AHEC if you're interested, especially in the healthcare field.
AHEC also enjoys solid relationships with institutions of higher learning throughout the region and continues its partnership with the University of Texas Health Science Center in San Antonio through the Center for South Texas Programs.
I'm the chair of the science department, biology and chemistry, and we worked to start this program this summer. Because of the success of the program, we intend to pursue it again.
This partnership has certainly reaped many benefits for the entire South Texas region. The Mid-Rio Grande AHEC, for example, continues to introduce high school students to various healthcare careers, involving these young people in the many programs AHEC sponsors so that they can meet the healthcare professionals and learn more from them. South Coastal AHEC has also been a leader in developing community-based training sites for health professions students to engage in clinical practice learning and key provider of continuing education training for area health professionals. It all began with a meeting at a donut shop and a sketch of plans on a napkin. Now that napkin remains perhaps the most valuable part of AHEC's history because it's the seed from which the program took root and bloomed. Today, AHEC continues to plant seeds throughout the community, whether it's encouraging young people to venture into the healthcare profession, empowering local communities to take charge of their health and well-being, or helping established medical professionals increase their knowledge so that they can better educate their patients. As Dr. Sumaya so famously put it, it's a heck of a deal.